one of the treatments. You obviously did chemo with your situation. What are your thoughts on those options now, surgery, chemo, radiation, having been through it and seen people going through it and now experiencing something different? What are your thoughts on those?
I think that there's a time and a place for surgery. If you have a tumor that is pressing on the colon or in the pleural cavity, pressing on the lungs, sometimes you do need to get that tumor removed. And that actually decreases the burden on the body of how much cancer it has to get rid of. So I'm not a proponent of not having surgery. What I disagree was with my doctors did not tell me there's absolutely no change in the statistics for survivability with a mastectomy versus a lumpectomy. But instead what they told me was, oh, don't get the mastectomy because if you have a lumpectomy, you have to have radiation and that ruins the tissue and the tissue won't ever heal well. If you ever have another small tumor, we won't be able to do reconstruction. And so it was sold to me that just, you know, do it this way and get it all over with. But what I didn't understand was all I did by doing surgery was keep cancer from coming back in that tissue that they put in the trash can. I did nothing to keep breast cancer from coming back anywhere else in my body. And I thought I was beating breast cancer by just having all my breast tissue removed. And I was allowed to believe that, and I verbalized that repeatedly throughout this journey, but I found that not to be true. So I do think there's a place for surgery. I tell people if it makes you feel good and you can be confident going forward and doing integrative therapies, then you better get that lump removed. But I just think it's so important to heal the body. If you're constantly poisoning the body and you don't shore up your armies, how are you ever going to beat this? So, you know, surgery is controversial for me. Sometimes I tell people, you know, you might want to, you know, the lady with the ovarian, you might want to get your ovaries removed. You know, get that out, and then let's get you on some great integrative, you know, working with a great integrative physician, and don't have this come back anywhere else. Chemotherapy, I'm not a big fan of, but if you're going to have chemotherapy, there's IPT. Have you ever had anyone explain IPT?
Yep, insulin potentiated therapy. Yep.
Right, it's not as strong, but you're using the mechanism of that the cancer cells feed on sugar to get the chemo right to the body. I know so many people who fail chemotherapy, but then there are people who do fine with it. But you are taking a toxic body and putting more poison in it. Instead of letting your body heal naturally, because the body's meant to heal. When you get a cut on your hand, the body heals. You don't go pour poison in the cut. But that's still how we're treating it. And we're treating it that way because we're waiting for the lump or bump. People are so sick, it's hard for the body to overcome these huge tumors that, you know, people are being diagnosed with. But if you find it early, that's when you don't even qualify for chemotherapy, surgery, and radiation. And that's what I love, when people can find it super early, they have the motivation to make a change. And I've had people tell me, Jenny, people don't want to know they have cancer. I'm like, yes, they do. I promise you. The first thing, if someone tells you you have cancer, that they ask you is, you're going to say, well, how bad is it? You want to know. And don't you want to know when it's the size of this dot, this piece of, I put a little dot of ink on my finger, that's where the Oncoblot or RGCC can find it, that small. Don't you want to know it's like that instead of, you know, the size of a marble? I'm like, believe me, you do want to know that you have it early. Because with 1 out of 2 men, 1 out of 2.5 women getting cancer, we can't hide from it anymore.